In August, 2 years ago, I was on a river voyage where our ship was docked at Budapest in Hungary. While getting ready for the first night captain's dinner, I was ruffling up a blouse that I felt something, a small lump in my breast. I did have a mammogram scheduled for the day after I returned from my journey, so I decided to continue the trip. 21 days later, after some wickedly painful biopsies, I found out I had a small cancer in my left breast. The first surgery did not show clear margins, which meant the surgeon had to go back in and do a second surgery. After consultation with my doctor and the oncologist, other cancer survivors, I decided to have a prophylactic removal of both breasts and 2 lymph nodes from under each arm. Prophylactic means it doesn't need to be done, it's not required, but it's a safety measure so that everything, every place, everywhere that the cancer might have had a chance to spread within my breast tissue and lymph nodes under the arms was taken from my body. The surgery went well. However, after the surgery, I developed a large swelling called a seroma in the area where my breasts had been removed. This seroma enlarged until it pushed the entire truncal area, which is the area beneath where my breast had been, down to my belly button and below, out so far that my waist measured well over 50 inches. I had never been told about lymphoma or that it was a possibility that might develop after breast surgery. And by the way, it can develop after many other surgeries. More about that later. My cancer results after 6 months were the best ever, and I have been told I'm cured. I do take a daily drug. However, I knew right away that something was very wrong. I did not receive answers or suggestions from the surgeon. A diagnosis came from the oncologist with a prescription for lymphatic massage therapy. Cried for several days, which is like me. Then I decided I needed to do something positive. So I did some research online and found help from the Lymphedema Society, books in the library, friends who came forward with information. I did find, to my dismay, that 90% of breast cancer patients are not told that lymphedema is a possibility. Many people who get lymphedema, and it can occur in men also, get it in their arm or leg. So if you see someone with swelling in an arm or leg, it just may be lymphedema. By the way, every surgery you have may remove lymph nodes. So for example, if you have a hysterectomy or a C-section or a hip replacement, you lose lymph nodes. Okay, so I had lymphedema. I spoke with a doctor friend of mine, and she told me she did not feel confident to treat me and suggested I look elsewhere. The MLD specialist mentioned Dr. Lee's name as someone she had asked to look into her own allergies. I called him and asked if he was willing to take on a lymphedema patient. His name is Dr. David Lee, and he's an acupuncture nutrition specialist in Thousand Oaks. I am used to Eastern medicine, was very acceptive of it, and acupuncture had previously worked for me, so I welcomed his response. He put me at ease immediately, as we continued to discuss what our plan would be. Dr. Lee saved my life in sanity. When I first went in, he measured part of my body skeleton and had me take a questionnaire which asked me easy-to-answer questions like, do you like heights? Would you rather be warm than cold? Do you like to get up early or stay up late at night? I found out that the questionnaire results told him what foods would provide me with the right nutrition to help fight the growing protuberance in my belly. I followed the food list he gave me, which is also on his website, and began to see that the large protuberance was gradually shrinking. Along with the food choices, which are copious, and foods that I like very much, he told me to swim every day. He also told me to use a sauna and to drink the food supplements he gave me, which varied from week to week. He actually gave me a prognosis signed by him, which I still have, which states that if I would follow his care plan for 8 weeks, I would see 70% improvement. My cooperation would be in the area of following my diet plan and taking the herbal medicines and doing the exercises that I previously mentioned. After a few weeks of working with Dr. Lee, I found that the food choices were what I now wanted to eat. On occasion, I would eat something not on my plan, and about 70% of the time I followed the plan. Maybe 1 or perhaps 2 days a week, I might eat something not on my plan. I found myself losing weight and have lost nearly 100 pounds. My swelling has diminished almost entirely, and now I can wear size petite. And I will tell you that nothing tastes as good as thin feels, and nothing feels as good as not having this swelling within me. My energy level is up. I do not have allergies anymore. My nose does not run. Chronic fatigue is something that has gone from my life. My elbows don't ache. I don't get any kind of headaches. My balance has improved tremendously, as has my gait. My strength and energy level are way up. Wait, there's more. My fingers don't hurt. Neither do my hands. In other words, I don't have arthritis. And I can give someone a great massage with no problem. My doctors, other than Dr. Lee, have told me they have never seen a recovery like mine. And would I please write out the plan that I followed for them? This I have done for them. Dr. Lee gets 90% of the credit for my loving life and being happy, healthy,